Kia ora koutou. Hello and welcome. Thank you all for joining us today. This is a webinar on how to manage your health and safety obligations and play it safe when returning to work at Alert Level 2. I'm Olivia Lund, a partner at Duncan Cotterill, and I'm going to be the host today. As you will appreciate, there is an abundance of information and guidance in the market as to how organisations should manage their health and safety obligations and minimise the spread of COVID-19. The purpose of today is to provide you with an overview of the fundamental health and safety obligations and principles that apply to all businesses operating at Alert Level 2. Now, there is specific advice that is available and that should be followed for your own industry. So the format today will include short presentations of around 10 to 15 minutes from each of our speakers. There will be a Q&A session to follow. So I will facilitate the Q&A session and select the questions to be answered by the panel. The questions aren't published, so only I can see the questions that are posted. Personally, I'm looking forward to the Q&A session, as I think that's where participants get the most value. But also, I have personally a number of queries and concerns with the rules and how they are going to work in practice at Alert Level 2. So we're not here to criticise the rules. They are inconsistent in places and difficult to rationalise when you compare them to each other, but we just need to do the best that we can in the circumstances. So the webinar will be recorded and a link will be sent out to all attendees together with a copy of the slides after the webinar. So on that note, I am pleased to be able to introduce our first speaker, who is Tony Hetherington. He's going to give us the voice of the regulator, WorkSafe New Zealand. So Tony is the Acting Chief Operating Officer of WorkSafe. He leads the day-to-day operations across WorkSafe. Tony spent over 30 years at the Health and Safety Executive, which is the equivalent of UK's equivalent to WorkSafe. So we're very lucky to have him with us today in what I know is a very busy time for him. So Tony is going to let us know what WorkSafe's approach to Alert Level 2 is. He is going to let us know what guidance WorkSafe has released and also give us some insight as to the role that WorkSafe is going to take as the regulator in enforcing compliance with health and safety obligations. So over to you, Tony.
Okay, thank you for that introduction. I think I will start with where are we as a regulator in this. The important thing I think you have to take account of now as we move into Alert Level 2 is actually what we are trying to manage very definitely is a risk to public health and transmission of a virus within the general population. So we are not dealing with a traditional health and safety risk which just affects the workforce. We are dealing with something in a much wider context. And the standards that we are attempting to apply to the workplace are the standards that are developed by the Department of Health. And then we are attempting to turn those into guidance for people who are actually at work. And that's the sort of material you'll find on our website. And you should be able to see a direct line of sight between the Department of Health overall guidance and the more specific material you find on our website. I have to say that just at the moment, some of the areas that it's suggested are in some slightly difficult to understand. I would have to have agreement with that because we have not yet entirely and finally settled precisely what position the Department of Health are going to take on some issues. So that is why you will not find all of our guidance being definitive. What we are doing in relation to industry-specific guidance is that at Alert Level 3, we did work with a number of industry bodies to endorse their guidance, and that was all accessible through a link on our website. With the move to Level 2, partly because of the relatively short timing and partly because it now involves the whole of industry and commerce. There are many more industry bodies wanting to develop industry or sector specific guidance, that it's just been impossible for us to fully endorse everybody's guidance. So what we're doing is working with your individual industry bodies to make sure that we are able to at least agree the guidance, if not specifically endorse it. So if you want industry specific guidance, the best place to go is to your industry representative body, but you will also find, as time goes on, links from our website to various industry body websites. So just I have to say, at this stage, you will have to bear with me a bit about some of the detail of what might or might not be required in specific circumstances. And Mike Cosman, who's going to follow me, will talk quite a lot about detail of what might be required or should be required in various circumstances. But I just thought I would then try and cover some of the principles that people should be thinking about. And I think if you're a business that's already been operating at alert level 3 and you're not automatically going to extend the nature of your operations, my advice would be to continue as you are. Most of the principles of protection at alert level 2, at alert level 3, are entirely relevant to alert level 2. The move to alert level 2 is driven partly by a belief that the population risk from viral transmission is lower, but also part of what is driving, allowing more people to get back to business, is to try and balance the economic benefits of having more business activity, and that those benefits also flow through into the general health of the population. It is actually good to work generally rather than to sit at home. So where we talked about not absolute consistency, I suppose one of the things you would say is that sports may not be particularly important for economic activity, but they are very important for many people's wider psychological health. And I think therefore the Department of Health has decided that whilst there may be some difference of actual risk associated with transmission of disease from certain sports activities, the overall benefit to the community is acceptable. I think what you've got to remember is the whole of the golden rules or basic principles to protection are about separation, first of all. Keep individuals and groups apart. And I'm sure at some stage we will delve into what exactly a group means and how you keep them apart. I think the big thing for people to remember is if you're having any sort of shared venue where different groups come in and are nominally kept apart, is actually think about whether you're really keeping them apart at all times. So, for example, in a cinema, you could keep people apart within the auditorium, but make sure that as they come and go to the auditorium, you don't have various of these groups mixing in the foyer or mixing when they go to the toilets or use other facilities within the building. So remember, separation should mean separation at all time, not just most of the time or in big groups. If people are able to travel between two groups, that is not separation. Important is cleaning, and that's cleaning of the hands. So make sure that you have plenty of either sanitizers or washing facilities, and make sure that surfaces are cleaned regularly. And cleaning regularly isn't just one consideration. It really means every time some sort of contamination is likely to change. So if somebody is using a keyboard for a minute and then hands it over to somebody else, then that keyboard probably needs some cleaning regularly every time it's turned over between people. Make sure you've got a robust procedure for dealing with people with symptoms, and that is primarily about making sure that they don't come into your workplace or into any of your activities if they are showing signs of ill health. make it very clear to your employees that you will support them at home. And also, I, in general, wouldn't advise anybody using breathing protection here. The one time where you might want to hand out breathing protection to your employees is if you have somebody at work who you believe is showing symptoms, and then to protect other people, you may give that person a mask to wear on their way home. So very important to keep record keeping for contact tracing. Department of Health are very keen that if there is any sort of outbreak, that we can trace people and then isolate anybody who might be transmitting the virus. And that's one really key part of control. So make sure you can have good contact tracing and good records. And then to make all of this work and make sure it's practical, discuss your arrangements with your employees. So make sure that as you talk to them about what it is you expect them to do, but also listen to them about what they know about how the business works and where people may or may not be properly controlled or properly separated. I think the other thing to say is around PPE or breathing apparatus or protection. We think that should be a very rare occurrence where anybody outside of the healthcare sector needs to wear any protection. All the other means of control in the current situation should be enough to control the risk. But I do recognise that many people will feel that they either want to use protection because they are concerned that they either will be exposed or they may transmit disease. And for some public services where people are very in close proximity, your clients may expect it. And I've got no problem with any of that. But I think if you do wear PPE, you make sure that it is worn properly, not worn for excessively long periods, and is disposed of in a sensible way. No use collecting virus on a piece of PPE, a PPE pad, and then getting it on your fingers, transmitting it to your mouth, etc. So do use PPE carefully and do work from the basis that it will be relatively rare when your employees will need it if you're working in any other area than health services and health, as a health professional or some directly caring profession. So I think that's just about my 10 minutes. So I will hand over to, I think, Mike now, and wait to see what we get in the questions.
Thanks, Tony. I'm not going to let you off the hook there. I've got a number of specific questions I just wanted to ask you in relation to WorkSafe before I hand over to Mike. So the first question is WorkSafe going to use its enforcement tools to ensure compliance? So not only around the investigation and prosecution, but improvement notices and prohibition notices?
Well, up to now, WorkSafe has largely relied on police enforcement where something was directly related to COVID-19. And going forward, under Alert Level 2, the government is currently debating a bill which will give various powers to regulators to deal with matters under Alert Level 2. So at the moment, what would the powers be was still being debated in Parliament last night. So precisely how much enforcement we will be taking will depend, and how we will be taking that enforcement will depend on the powers we are given under the emergency regulation. But I think as we go forward over the next 2 to 4 weeks, we will see our role in the next couple of weeks as being about supporting the advice and contact with business to support them getting to a good place. But I think as we move forward into the next 4 to 6 weeks, we are expecting that our role will very much go back to what is our core function, which is to deal with the 60 to 80 deaths per year from accidents, and the 600 to 900 health-related chemicals and other industrial exposures that kill people at work. So we will be changing our main focus over the first few weeks of Alert Level 2, much more back to where most of you would recognise us as a regulator. And we will limit our COVID response to what we see as serious breaches, and limit our enforcement activity to really serious stuff rather than dealing with detail. Does that answer your question?
Yes and no. For the audience that are wondering about the proposed laws, so they are enforcement rules around the physical distancing, gathering numbers, and the proposed laws before Parliament at the moment allow powers to the police and other designated persons under the Act to essentially shut down businesses or issue fines and infringement notices where those businesses aren't complying. And there is a proposal that might be in place for up to 2 years. So one of the questions is under those designated agencies or persons, will WorkSafe inspectors be in that role in terms of playing that enforcement piece?
Well, I think the place to look, I suppose, is to look at what we've been finding about Alert Level 3. And our findings have been that we have taken needed to take relatively little enforcement action. Somewhere I have the figures. We've done something like 900 assessments since Alert Level 3, 900 COVID assessments. We served 76 notices. So that gives you a feel for, I think, the level of enforcement activity that we found or was necessary. And that's much lower a rate of enforcement activity than around our traditional areas. So I think we expect and anticipate that most people and most business operators will wish to stick to the rules. That there will be an element of self-policing in that if you're obviously not sticking to the rules, lots of your clients will stay away. So there will be a self-policing aspect there. And I don't think we anticipate that we will have a large role in enforcement beyond the next 2 to 4 weeks. Although, that on the basis of never say never, that is assuming that we remain at Alert Level 2 and that what we anticipate will be a good level of compliance by commerce is actually delivered. Mm. And remember, the areas, I suppose, where people will have most concern are all those things like, parties and late night in drinking establishments and clubs, or there's a possibility around how large gatherings, potentially religious gatherings or things like that, where actually there may or there may not be people at work, and the concern would be if you try to stop them, the issue might be more one of public order rather than health and safety. Mm. So, there are quite a lot of delicate issues to be dealt with, and for me to lay down, exactly what we're going to do will very much depend on how New Zealand commerce and the New Zealand public responds to the position.
Yes. Just touching on the endorsed industry guidance. So there is a number of industries now that have endorsed guidance, and links to that on WorkSafe's website. Nearly all of the main industries, actually, construction, farming, forestry, retail, hospitality. That's not generally WorkSafe's approach to endorse such widespread guidance. Do you think that we'll see more of this from WorkSafe in relation to the general traditional health and safety risks in the future?
Well, I think WorkSafe will always want to develop guidance which is relevant to industry, and if we have looked, I think being quite frank with you, Some of the ways that we've developed the guidance that we have put onto the website recently, we've managed to do probably about the 10th of the time it would have taken us in other circumstances. So maybe there's something for us to learn there about sometimes it's better to do things and get it 95% right rather than to sweat every little detail. So, you know, I mean, if you're saying, do I think WorkSafe will go away and review and exactly how it's responded to the recent pressures, then absolutely, yes, I think we are learning and thinking as we go even now.
Yeah. Right, well, I think that's a good point to hand over to Mike Cosman. So Mike Cosman is a partner of Cosman Parkes. He's well known in the health and safety space in New Zealand. Mike has over 40 years experience as a regulator, manager and consultant, and provides advice to a number of public sector and private clients, including health and safety governance boards. So Mike's going to cover the guidance for controls and hopefully give us some practical tips and discussion around how they apply in practice and in these COVID-19 circumstances, but also how organisations can manage their business as usual risks together with the new COVID-19 risks that we need to deal with. I know that Mike's particularly looking forward to the Q&A session and hopefully we'll see some argy-bargy between Mike and Tony. Disclaimer, they did work together in the UK, so they know each other, so it's all in good fun. So over to you, Mike.
Thanks, Olivia, and good afternoon, everyone. So look, I want to just quickly run through a number of different scenarios and really just provide a recap on what hopefully most of you are very familiar with. So really we've got two different cohorts of businesses that we're interested in at the moment. Those who have been operating at level 3, some of whom were previously operating at level 4. And then we've got those who will be coming back to work for the first time tomorrow morning after an extended period of being laid off. So in terms of what changes from level 3 to level 2, so really not a lot. So as Tony's already indicated, most of the controls that would have been in place at level 3, ensuring that your workers are in good health before they come to the workplace, about distancing or the use of barriers, about hygiene standards, both personal hygiene and around high touch or common use items, about restricting movement within your workforce so that if there were to be a suspicion or a confirmed case of COVID-19 amongst some of your workforce, that they have effectively been isolated from the totality of the workforce so that you don't have to close the whole office or shopping mall or factory or whatever it is down, but can do so partially based around where the exposure has been. Contact tracing, which Tony has already mentioned, but which I'll discuss further in relation to the new level 2 businesses. So I guess really the two key changes are that vulnerable workers, whether through age, whether through pre-existing medical conditions or through pregnancy, who up to now have been discouraged from working, can now return to work if they choose to. It's not mandatory, and obviously each business will have its own arrangements as to what happens if somebody chooses not to come back to work. But the advice is that it's sufficiently low level of risk now in the workplace that those vulnerable groups can generally now return to work. But equally, for those who have been working from home successfully, there is no requirement to come back to work. And indeed, I think the general advice would be, because of other issues, particularly related to public transport that I'll mention in a moment, that it's probably a good idea for people who can work from home and who are comfortable doing so to continue to do so. In fact, I heard on the radio this morning that Facebook have decided to make working from home now a part of their normal business rather than just making it something that happens in exceptional circumstances. And I think that's one of the sustained changes that we're likely to see across a number of businesses, is much more flexible and remote working. But for those who are new to level 2, and if we have the next slide. Thank you. The general message is that it's an ability to open up. It's not a requirement. So it's still up to each individual business to decide whether they can operate safely and within the rules. They don't have to. And equally, not everybody has to open up at midnight or at 7 o'clock tomorrow morning. Apart from obviously the bars, who we know have got a further week, and the schools who don't open until Monday, it's not a requirement that you have to open on the first day that you can. And it's particularly important, I think, that you plan to resume working, having thought through all of the related issues. So obviously the key thing that's going to change is now the level of interaction with the public in workplaces is going to increase. Up to now, it's been absolutely minimal with contactless click and collect or similar. But now we're actually inviting the public back into our shops, into our cinemas, into our cafes, and a whole variety of other businesses. And I guess the key change is that whereas we generally have a level of operating discipline amongst the workforce, we can't necessarily apply the same discipline, training, provision of equipment, and so on to the public, who may only be in our workplace for 5 minutes at a time. And so that's why we have to be quite careful that the risk is substantially different now when we're dealing with that mingling of public and workers. So Tony's already talked about the sector-specific guidance, and there's some very good stuff, but equally there are some gaps. And some of those gaps are going to cause people quite a lot of concern over the next few days. And one of them is around the whole issue of personal services and what level of personal protective equipment may be required if you are a hairdresser or a massage therapist or some other kind of non-medical but close personal service that requires you to be within 1 metre for an extended period of time. And at the moment, the guidance around that is really quite equivocal as to whether it's the service provider or the customer or both who has to wear personal protective equipment, and what kind of personal protective equipment that might be. And I'll come on to that in a bit more detail in a moment. The other point I just want to emphasize is about engaging your workers, because we know that, that's a critical part of good health and safety generally, and never more so than now when we are making fundamental changes to how work is done. We need to make sure that the workers who are having to follow the rules are on board, are involved in the development of those rules, and can give us robust feedback as to whether it's going to work in practice or not. So if we can move to the next slide about making ready. So bear in mind, that many workplaces were shut up in a hurry, not dissimilar to what happened after the Canterbury and the Kaikoura earthquakes. So we have to think about some real basics. So, the air conditioning may not have been running. So we need to ventilate the building and get it up to a proper temperature, reduce damp, and make sure that everything is working effectively. If there are wet air conditioning systems that have been sitting there in, unseasonably warm weather, there may be a Legionella risk that we have to think about. So should we be getting in the maintenance people to shock dose the air conditioning system before we run it for the first time to make sure that there isn't a build-up of Legionella bacteria? Running taps. There is still some, lead piping in the system. Water's been sitting in storage tanks for a while. So particularly for food service or canteens, run those taps for a few minutes to get rid of nasty taste and any contamination. Obviously, clean and make sure that everywhere is shipshape and ready for the public and workers to come back. Look at your stock levels about the equipment that you might need. because some things that were repeat use might now be single use, as simple as coffee cups. If we've had a drawer full of coffee cups in the smoko room, but now we're discouraging people from sharing those, and we might be going over to disposable cups, then make sure we've got enough of those, as well as all the other stuff, whether it be around personal protective equipment, hand sanitizers, disinfectants and the like. Really think hard about the layout of the workplace and look at every aspect of the customer experience, which is, a jargon term for saying where people go. So, how are customers going to get into your premises? We saw the issue with the burger bars in terms of people queuing unsafely. So how are we planning around safe queuing? How are we planning around perhaps one-way systems within the store to reduce the mingling? What are we doing in terms of positioning items within the workplace that encourages that flow and encourages that distancing? If it's a clothes shop, think about the changing rooms where people might go to try on items of clothing. How are we going to manage that? How are we going to manage risks of contaminating the clothing or those high-touch areas within the changing rooms? So really thinking through every aspect of the layout of the workplace and the way in which people interact with it. Providing signage, whether that be general signage or the marks on the floor, the visual cues that remind people about maintaining distance. And if we've got safety critical plant and equipment that's been lying idle for some time that may have gone beyond its servicing or certification date, just give that a check and make sure that it is fully up to speed. We'll need to reinduct everybody coming onto the premises in the new procedures. So again, in terms of a staggered opening, we may want to think about bringing people in a day early to run through all of that with them to make sure that they're fully comfortable with it and rehearse it before we get the public in. And thinking about what is the impact of these new procedures on the business as usual risks, the things that Tony talked about, which are the ones that contribute to the 60 or 70 acute deaths or occupational ill health, because some of those risks may have changed because we've changed our work practices. So if we have a management of change procedure, then we need to make sure that we apply that to the differences that are occurring at the moment. We also need to think that workers who've been laid up for 6 weeks may be in a poorer physical condition. So particularly in heavy manual jobs where people build up physical conditioning, that may have diminished. So we need to think about how we're going to reduce the risk of musculoskeletal injuries. And very importantly is considering the stress and anxiety. So people who've been told to treat everybody who isn't in their bubble as potentially infectious, we're now asking them to mix with hundreds or possibly thousands of people in a workplace setting. And so we have to think very much about how we address their anxiety. And that suggests that we may need to do some things which are not necessarily fully justified from a health and safety point of view, but which are actually there to reassure our people. So coming back to the principles, this isn't business as usual. This isn't level 0. This is a new normal, and we could be in this state for an indefinite period of time. So we need to put the effort into making this work for weeks, possibly months. We still need to be cautious. People could be infectious, even though we're hoping that the base level of COVID in the general population is low. We still have to think about this. And the advice from the Ministry of Health is that if anybody has got any symptoms, cough, sore throat, sniffles, high temperature, that we treat it as if it could be COVID and get them tested and exclude them from the workforce. And that's where I think the whole question about employment relations issues, which I know Brian is going to talk about in a minute, is really important in terms of, well, if I don't come into work, will I get paid? Because what we don't want is to have financial pressures encouraging people to come into the workforce when they shouldn't, and hence risk exposing other people. Have we gone to the next slide, please, Olivia? So the whole question of contact tracing. So this is one of the areas where the information is currently a little bit equivocal. So contact tracing is obviously really important, and we've seen from the recent situation in South Korea where it's been both very helpful, but it's also had its limitations with people giving false names and not being able to be contacted when there was an outbreak. So businesses need to think about how are they going to do this? Are they going to have lists of names and addresses? Are they going to have QR codes that people will scan? And unfortunately, in the absence of a government-approved system, there's a multiplicity of systems out there that have been developed. And so you're likely to find that every place you go has got a different requirement, and there won't be any degree of commonality between them. You might have to download 6 different apps onto your phone if you're visiting 6 different workplaces, because they'll all have different requirements. We need to think of privacy, because just leaving a list of names and addresses and phone numbers on the counter means that other people can see who's been there before you. But equally, because we're really trying to build relationships with our customers, particularly for those small businesses, there may be opportunities to, subject to obviously the requirements about spamming, to actually use this information to build a customer database and to maintain a relationship with those customers. Prime Minister's talked about the 3 S's for hospitality, which is separation, seated, and single server. So minimum separation between tables. Everybody must be seated with no bar or counter service, and only a single member of staff to serve each table, although the same member of staff can serve multiple tables, which I think was an area of confusion when this was first announced. Personally, I'm a little confused between contactless takeout and counter service, particularly if there is a sneeze guard or a screen at the counter. And that, again, I think is an area that will need to be thought out, hopefully in the advice coming from the hospitality sector. The new rule is a maximum of 100 in any indoor or outdoor venue. But what constitutes a venue? So Tony talked about the cinema. So if the cinema has got 5 different screens, is that a limit of 100 in each of the individual cinemas, or is it a limit of 100 in the whole venue? I think provided that all of those areas that Tony talked about, bathrooms, cafe, the foyer area, if they can be subdivided, so we're not getting mixing between those groups, then my view is that 100 limit should apply per cinema, or in a food court or somewhere similar, could apply to each food venue. And as we also know now, the maximum per group in hospitality, funerals, weddings and the like is 10 people. And certainly listening to the debate in Parliament last night, that's one of the most contentious issues that the National Party have strongly opposed. And depending on what happens in the 3rd reading of the bill that Tony referred to, we might see some modification of that number either now or in the near future. So just finally then, this is our advice, which isn't necessarily official government policy, and indeed in some instances is contrary to it. So I think a big challenge with public transport is that in order to keep to the 30 or 40% occupancy limits which are being set, people are going to be very frustrated because the bus arrives and it's half full or less than half full, but nobody's allowed to get on it because the current rules say that you must keep every other seat free. My personal view is that both in order to increase occupancy on public transport and also for reassurance on buses and possibly planes, I think wearing of masks is a good idea, and I would actually encourage it, but subject to what Tony has talked about, which is change it, know how to put it on and put it off. But I think the advice, which Ashley Bloomfield has said is still unclear, but I would err on the side of wearing a mask when using public transport, but probably not in most other locations. we're going to have to change things very rapidly within the light of experience. So daily pre-start briefings with our people to review the effectiveness and the practicality of the measures so that we can actually change them pretty quickly. Using health and safety reps to promote the key messages, and also to act as safety monitors to help to keep our fellow workers on track. Think about broader public health messages. So flu vaccination. My feeling is that most people will be more receptive to having a flu vaccine this year because of all the raised awareness about the risks associated with infection. But also think about smoking and vaping, because those are areas where hand-to-mouth contact is very common. And so when we're trying to stop people touching their mouths, then actually further encouraging a reduction in smoking and vaping is something I think to be recommended. As I've mentioned, be willing to introduce measures that offer reassurance, even if they're not particularly effective, as long as they don't give false confidence. And so the one that I have a bit of concern about here is temperature checking, because the evidence now suggests that 60% of people who are COVID positive won't have an elevated temperature. And we also know that individual temperatures vary significantly based on a number of factors, including things like ovulation and pregnancy, but also through things like having had a flu vaccine can increase your temperature. And so there's a danger if we get a large number of false negatives, so people who've had a temperature check and are told they're okay, are then less likely to follow all of the other hygiene measures when they get into the workplace. So my final slide, just as a recap, focus on the core concepts of what good health and safety looks like. So don't forget the importance of leadership, of risk management and worker engagement. From a governance and a senior management point of view, we need to think about how do we provide proactive assurance that the controls that we've got in place are actually working. And as the Prime Minister has told us, wash your hands, wash your hands, wash your hands, be kind to each other. And Tony, I haven't forgotten that actually the things that are killing most workers in New Zealand are actually the things that have been killing them for the last 100 years in terms of both acute and chronic health and safety risks. So thanks, Olivia. Over to you.
Great, thanks, Mike. There are a number of questions on PPE and contact tracing and physical distancing, which we'll wait for the end. So finally, we're going to hear from our very own Duncan Cotterill partner, Brian Nathan. Brian is one of our senior partners. He probably won't like me saying that, senior partner, but he is definitely senior to me in terms of partner rank. But he is going to cover the health and safety issues from an employment lens. So things such as, how do you manage changes to an employee's work due to these new health and safety changes that we're implementing in the workplace? And what are the obligations in relation to vulnerable at-risk workers, or workers who just actually don't want to come back to the workplace because they have anxiety or fears around COVID-19? So over to you, Brian.
Thanks, Liv. Kia ora, everyone. Hey, well, disappointingly, I guess there are a bunch of legal overlays which apply to everything that particularly Mike has just been talking about. And it's interesting to hear Mike's observations around the importance of leadership and engaging with your workers. And really, when you think about those things in a legal sense, they fit pretty well into this context. First up, of your obligation of good faith, which of course is the obligation that prevails throughout the duration of your relationship with your employees, and will be really important to have that tucked away in the back of your mind as people with higher degrees of stress and anxiety slowly return to the workplace now. And dovetailing also with what Mike has been talking about regarding the importance of engaging with your workers. And again, that really is encapsulated in your obligation of good faith. And one thing that's important, I think, is to listen to what your workers are saying with an open mind. Ensure you receive what they are saying with an open mind. don't just be dismissive. People will have higher degrees of anxiety and concern than might normally be the case, and I think now more than ever is a time to step up as a leader and be open to listening to those workers' concerns, so that people can return back to work feeling okay about it. I don't think people should rule out the fact that there's a broad spectrum of feeling about how big a risk this is, and you shouldn't assume that everyone is blasé about it. So be active and constructive, and provide plenty of opportunity for comment. The other end of the spectrum, maybe just next slide, Liv. Unfortunately, the nature of that part of the practice, my practice, which is employment law, frequently this is actually what I end up looking at, because this is when things have turned pear-shaped, and I'm looking at, well, has this termination of employment been done satisfactorily, and would it fit with this thing, which is the test of justification? And the reason that it's worthwhile just briefly touching on that now is that it's likely to be, in hopefully rare cases, a circumstance which you might need to reach for if things aren't working out well. You've got people who are refusing to return to work and unjustifiably, then you're going to need to be able to make sure that the steps you take to deal with that would be what a fair and reasonable employer could have done in all of the circumstances at the time. And I guess so that those two things are a little bit opposite end of the spectrum. You've got your good faith obligations, which are going to run throughout, and you're hoping that's going to be productive and leading to an ongoing useful employment relationship. But there's this test of justification, which you might need to be starting to think things through if things aren't going so well. I guess now than ever, this has really been interesting from a law firm perspective, because law firms as a rule have had a rather antiquated view about the importance of presenteeism, and the Band-Aid's sort of been well and truly ripped off with that. And now people have realised, well, actually you can work flexibly and productively at home, and of course working from home has been the new norm for people, such that I see that we're even, it's now even have an acronym. So WFH is a new thing, and that's something that could well be locked in for the future, which I'm sure many of you will see as just a really good thing, but for others it will present an ongoing challenge. As it fits into the environment that we're now moving into, it does fit with your obligations around ensuring the workplace is safe. Having alternative ways of working, which could include working from home, will be a useful tool in minimising the people that you've got around, which will in turn minimise the chances of contact, and therefore something that you should definitely be considering as a way of making your workplace safer. The test, of course, is exactly the same as the test has always been under the Health and Safety at Work Act, and you've got to do whatever you can do reasonably practicable to ensure that workers aren't exposed to harm, and so that's no different than it has for all the other things that Mike and Tony have been talking about, have been injuring people for decades in New Zealand. But now we've got the somewhat more insidious problem, and it's not as obvious as a spinning blade which is unguarded, and so you need to think a bit more ingeniously, I think, about what shift work might work, staggering shifts, staggering meal breaks, and what other flexible arrangements will work for you, but also what are going to work for your staff. And in that respect, you really end up circling back to the importance of engaging with your staff about this. And obviously the steps that you might take might differ between employees based on their own personal circumstances, and particularly if some of them are high risk. and I'll have a talk later about what is vulnerable. It's a strikingly long list of things, but there's a process, of course, just like any employment process, about agreeing to variations, and so that will engage your obligation of good faith. So you're going to have to talk to people about it. You're going to have to give reasons for it. You're going to have to listen, and people are entitled to get advice about changes if they want to. And it would be sensible to try and pin down alterations to people's terms and conditions of employment into writing, if you can. And I know that it's sort of easy for lawyers to throw out those comments, oh, you should pin things down to writing, it's going to make a big difference. And I realise that for a lot of people that is nothing other than a nuisance. I guess that the problem is that frequently, certainly me, I'm looking at things from the ambulance at the bottom of the cliff, and certainly if you're at that point, it's significantly advantageous if you have got things in writing. Just maybe next slide, Liv. In terms of working from home, it's important to make sure that people are working from home well, and things that aren't so good are people working around the kitchen table and with crappy chairs and a poor workstation setup. Just because people are working from home isn't some sort of silver bullet for you as an employer in relation to their safety at home. And so common hazards, obviously, for people at home will be the sort of strains around neck and shoulders and wrists, eye strain and the like, that in a good workstation at the office, people are well set up to avoid. But of course, you might have very limited visibility on the nature of the workstation that people have at home, and you want to be more in tune with that than maybe you've been in the past, particularly now that there's more choice around working from home rather than the rather hurried departure that most people will have had from their workplace way back when we got forced into the lockdown. But look, there's plenty of guidance around that, and I'd encourage people to familiarise themselves with that. So who is vulnerable and at risk? As I've put up on the slide there's a few people that fit into that category. The list of underlying medical conditions is really long, and it's all again available. You can find that in the Ministry of Health information. But examples are respiratory diseases, heart conditions, obesity, kidney disease, immunocompromised conditions. It would include people, for example, who are undergoing treatment such as cancer treatment. And so it's worthwhile being aware of the health status of your employees and before having them come back to work. And so I think that it's a good idea to consult with your staff about whether they are or are not going to be a person who is at risk or vulnerable before they come back to work. If they are those sort of people, there is a leave support scheme, and this used to only apply to the essential workers, but now, in fact, it was called the Essential Workers Leave Support Scheme. It's now, just as you can see on the slide, COVID-19 Leave Support Scheme. I've set out on the slide the basis on which you would be entitled to it. A little bit like the wage subsidy, you're required to use your best endeavours to top it up. But it's of a more limited scope to the wage subsidy, so it applies to those people that are listed there on the slide. Just about all New Zealand employers would be eligible to apply. Not most state sector organisations would not be, I should hasten to say, which would include district health boards, for example. Okay, what do you do then if you've got someone who won't come back to work? This can be, this can be difficult. I've had some experience dealing with it over the last 6 weeks myself, and then you need to circle back to the test of justification, which I referred to right at the beginning. But first up, I guess you need to make sure that you yourself as an employer are ticking all the boxes about making sure that it is actually safe for people to return, because that's your obligation first up. And if you've done that, then it makes it more difficult for the employee to say that, no, I'm not coming back because I'm concerned that I may be exposed to serious harm, which is what the Health and Safety at Work Act talks about in terms of an employee able to cease work. So if you've done that, then you hopefully have done everything reasonably practicable to ensure that not being exposed to serious harm, which would include being a risk of being exposed to COVID-19, and that would start to cut down on the, for want of a better word, excuses that someone might be offering up as to why they can't come back to work. So the example that I have dealt with myself was someone who was refusing to, in a sales role in an essential service, to go to the supermarket to attend to merchandising, and so steps were put in place to ensure that it was safe for that person to go to the supermarket, so there could be time out of the hours when the shop was otherwise open to the public for the person to go there. They were still refusing to do that. Off to the side, we knew that this person was also happily going to the supermarket to do their own shopping, so we had a suspicion that there was a degree of being given the finger by this person. So that didn't help matters, as you can imagine, in terms of trying to communicate and get things to a place where we all reached an agreement. But in the end, the employer in that situation was comfortable enough that they had done all they could do to ensure what was reasonably practicable to make this person feel safe, and they still wouldn't follow that reasonable and we would say lawful instruction to return to work. And so hence the focus on the test for justification in the end. So look, there are steps you can take if you feel like you've done all you can do, but you have an employee who is refusing to cooperate. And hopefully that's in the tiny minority of cases. So people who are not eligible, just quickly duck back to that slide, Liv, here, people who are not eligible for the leave support will be the sort of person that I've just described. So if it's reasonable for them to follow their instructions, but people have a right to refuse to come back if they feel safe. And that's it from me.
Great, thanks, Brian. So first up, a question for you, Tony, just in relation to the COVID-19 safety plan that organisations required at Alert Level 3. Is that a requirement under Alert Level 2? What's WorkSafe's position on that?
I don't think we were going to take enforcement action if you didn't have one. But actually, if you want to make sure that you've had some systematic thinking about what it is you're actually going to do, and recorded what it is you're going to do so that you can share it with others, including your workforce, why wouldn't you use the plan and the format that's easily available on the website? Would be my response to that.
Yeah. One for you, Mike, just on in terms of interpreting the guidance and the requirements at operating at Alert Level 2 in relation to the numbers, so that 100 limit in a venue or a premise. So what is your take on that in terms of workplaces where there are, say, an office and there are more than 100 workers in there? Is that okay? And then also in relation to meetings, if you can manage that 1 metre physical distancing, is it okay to have more than 10 people meeting together in an office setting as a workplace?
So, look, I think the message is still that from a risk management point of view, the more we can reduce contact between people, then the lower the risk of spread amongst that group, should there be a positive case. So if you've got a building that's got 6 floors and you've got 50 people on each floor, and generally speaking, they are not mixing and mingling between the floors, then that's absolutely no problem. If you've got a single building that's got 300 workers in it, then I would still recommend that you use the combination of time and space to keep those groups separate. So, the things that Brian talked about: staggered start and finish times, staggered smoko times. If one group needs to communicate with another group, that they do that either using electronic means or still maintaining distance. If they're going to share the smoko room, then cleaning it down between shifts so that you're not going to get that spread from the blue team to the red team. All of this is good risk management, because it makes the difference between having 10 or 20 workers stood down if somebody develops symptoms, as opposed to having to close the whole workplace.
Yeah. Just on contact tracing, a number of people are asking, well, how far does it need to go in terms of your employees? Should it be covering where they go at a lunchtime or in their personal capacity before and after work? What's the expectation around the contact tracing? Probably you, Mike, first, and then Tony, if you could give some insight in around perhaps the government developing an app for that.
So look, I think from an employer point of view, no, they don't have an obligation to trace where you go at lunchtime or after work. But I think we all have a responsibility, as individuals, to keep those kind of records, because if we are the contact of somebody who's infected, or we are the one who's infected, then we're going to need to be able to bring together all of that information about who have I mixed with at work, who have I mixed with on the bus, who have I mixed with in the cafe, who have I mixed with at the cinema, who have I mixed with socially. And that's part of the challenge, because if all this information is being held in different systems, then pulling it all together at short notice is going to be quite challenging. So the employer should really focus on what's happening within the workplace, or where workers are going as part of work. And we know that, for example, a lot of businesses will have lone worker systems. They may have GPS tracking in vehicles. Those systems are perfectly adequate, because they will tell you where somebody has been. If you've got an electronic swipe card system, or sign in, sign out, or a time code system for wages, that will be perfectly adequate on its own. But if you don't currently have those kind of arrangements, then yes, I do believe that you should keep a record of who you spend time in a meeting room with, if they're outside of your normal work bubble. Any visitors that come into the workplace should not only sign in and out, but also indicate which department they're going to. And so really the message at the moment, from my point of view, is that the more relevant and targeted that information is, the easier it's going to be for contact tracing if and when the time comes.
Mm. One part to that, Brian, which you could probably touch on, is just the privacy concerns and obligations around managing the information. There will be hesitation both from workers, but also from customers and clients coming to a workplace, handing over that information, and how's it being used and how will that be managed in terms of their privacy.
Yeah, that's a really good point. It was interesting myself. I had an experience myself this morning, just getting a takeaway coffee and needing to write my own name and phone number on a list of, just on paper, on a list on a table outside on the pavement, and you're conscious that, well, there it is. I don't know who else is going to see that for the rest of the day, and no doubt many people, and certainly that. Gives rise to some issues around your own privacy. And so, yes, you have obligations under the Privacy Act for sure, and about how you store that information and how you use that information, and no different to the obligations that you have under the Privacy Act now, and so you need to treat that information as you would if you were storing anyone's personal information. There's been some spectacular failures of the storage of people's personal information in the past, and this could be a really good example of that. That list in a gust of wind could blow down the street, and there'd be 10 pieces of A4 with multiple people's names and contact details on, which would be a dreadful breach of people's privacy. And so you need to make sure that you're doing that in a sensible way.
Mm. Tony, any intel from your position as to whether we might have a government-endorsed app for contact tracing? Or is that wishful thinking?
I'm not aware of anything across, that will get government approval at this stage. I think the concern at government level would be exactly the one that's just been articulated about security and data security, and I think I've got a fairly high degree of trust in the government that they won't suddenly become turned into a 1984 organisation. But you've always got to have that at the back of your mind: is don't allow the government to accumulate more information than it actually needs. And I think people will be wary of a government thing for that purpose, and I think the politicians are cognizant of that.
Just touching on PPE, and there's been a number of questions come through, so I won't be able to ask all of them, but perhaps for you, Mike and Tony, so the types of PPE are not specified for those close proximity, workplaces, those personal services that are being provided. What is your advice and recommendation to those businesses around providing PPE, who they should be providing it for, and also how do they manage supply issues? Because I know just our office and trying to get ready to get back in the office, not that we're going to be using face masks, but just hand sanitizer and wipes, it's just not available.
So look, I think the shift in messaging around PPE that I would try and communicate is this: that in healthcare settings where you're dealing with people who are known or at high risk of having COVID-19 and being infectious, that's where obviously the full PPE, the N95 or the P2 mask and gloves and face coverings and all the rest of it is absolutely vital. And given that there are still global shortages for healthcare workers, I'm not suggesting that we divert that to lower risk situations. And of course, the difference in those environments is about whether you are protecting the healthcare worker from the virus as opposed to restricting the spread of virus particles from somebody who is infectious. So that's why I think you can get away with a much lower level of protection: surgical mask, bicycle mask, simply a scarf or a bandana or something of that sort, which means that if you do cough, if you sneeze, and you don't get it into your arm in time, that you're not then spreading those particles, whether they contain COVID virus or flu virus or any other infectious disease. And so that's why I think in those areas such as buses and trains, I would recommend it. For the personal services situations, I would probably be the same, and just encourage people where they can to wear a low-level mask, which means that if they do cough or sneeze, that the worker who is providing the service to them is not going to be put at risk. The worker themselves, I'm slightly more relaxed about, because hopefully we've done our health checks with that worker before they've come into work, and that they are symptomless. But again, if workers want it for their own reassurance, then wearing a simple surgical or homemade or other mask, to my mind, is going to do very little harm, but it may provide reassurance, and it may also provide some measure of protection.
Tony, have you got anything to add to that?
I suppose I'm rather more of an adherent to the Ashley interpretation than Mike is. I think what's important to remember is what are the routes of infection with this type of issue, and it is particles getting into either your mouth, your nose, or your eye. And one of the most effective ways of doing that is hand-to-face contact. So don't assume that having a face mask on will prevent the virus particles getting at you, because they're just as likely to get into your eye. And one of the benefits of the face mask, if it has any, is that it stops you going from your touching your hand, touching to your mouth and your nose, because the pad of the face mask is in place. So much of the, if there is benefit to wearing a mask, it's quite frequently that it stops the hand to face or reduces the hand to face contamination. I think, as Mike said, most of these masks are actually designed to protect, to contain virus particles being spread by the wearer. They're not really there to protect the wearer from what's outside. They're there to ensure that any contamination from the wearer is not spread into the environment. And I think that's often something that isn't fully appreciated by people, that the level of protection they will obtain from a mask will be relatively low. But actually the point of the mask, if worn anywhere, is to protect others from the wearer rather than to protect the wearer from others.
Yep.
And if that's clear to people, they will often take a more rational view of whether a mask is a good idea. And I think that for the personal services thing is also just exactly which personal services you're offering and how you work is probably more important. You know, for the majority of things like hairdressers and the like, there isn't, if you're just aware of it, it's much easier to keep out of people's breathing zone than you might imagine, with just a few changes to the way you work. And it may be that you can offer almost all of the services, except for ones around dealing with, say, someone's eyebrows or something like that, where you can't actually perform the task without coming very close to their face. It's also worth businesses like that thinking, well, maybe I can offer 75 or 80% of my services and be quite comfortable that neither my clients or my workers are at risk. There's just a few things that we need to think more carefully about. And, you know, that when we talk about PPE, putting a visor on someone, which is actually probably the best way of protecting them from an infected person, is not something that many people would find acceptable in the retail or service industry. So I think you need to be carefully about what is the purpose of the PPE and how will it actually work in practice. And actually it's better to think through the detail of the services you're providing and think about probably the few key instances that you can cut out of your work. You know, because as Mike said, this is not back to entirely business as normal. This is back to a lower risk environment where we're trying to prevent a few possibilities of where the virus might get back into the population and be transmitted, is actually to take those out of the system. So if you think about it that way, it maybe puts a different light on the way people think about return to work and the services they will offer.
Thanks, Tony. I'm just conscious of time, so one more question, and it is a bit of a cracker to finish on, and it just relates to the main duty under the Health and Safety at Work Act is obviously to eliminate or minimise exposure to risk of workers, and when we're talking about that in this context, it's the exposure to COVID-19 in the workplace. The first question that I have and a lot of discussion from clients is, well, actually, what is the risk? Is there actually a reality that our workers are going to be exposed to COVID, or is that just a perceived risk? Because we don't have community transmission in our region, or we don't have any positive cases. So what do you say in relation to comments like that being made?
What do I? Well, I say that in order to enforce the AL2 levels, we will need different powers, which the government is considering giving to us. And I think, whilst it is nominally a health and safety at work risk, and in some circumstances it certainly is a health and safety at work risk, actually at level 2, what we are doing as a regulator is supporting the government's wider activities to control what is actually a public health risk. But we are doing our part in controlling the public health risk as it applies to people at work. It is health and safety at work. It is it's an aspect of health and safety at work, and it will certainly affect the mental well-being of many workers, as was alluded to. So it is something that you need to think about in Health and Safety at Work Act terms, and thus the idea of risk assessment, reviewing what you do, applying risk principles and modifying your behaviour, keeping your workers involved, all that is exactly the same things. But if you're talking about the level of risk, when you're getting down to where we are currently at alert level 2, we are about controlling a public health risk here.
Mike, have you got anything to add on that? We could probably debate this one, and also the other things that come up around cost. So when deciding whether a control is reasonably practicable, cost comes into it, and is that disproportionate to the risks? I've got a lot of clients saying to me, well, how far does this have to go? If I have to follow these controls and put them in place, it's going to be uneconomic for me to carry on trading. So when does it become disproportionate to the risk? And I suppose, carry on.
Yeah, no, I mean, really, really important question. So, I mean, obviously with any risk, it's based on two elements. So one is the potential severity, and the other one is the likelihood. So in terms of the potential severity, we know that this is a disease which has killed, getting up to 300,000 people that we know of around the world. And so in terms of the potential to cause harm, it's very significant. What we are knowing or learning more about is the likelihood of people being harmed in New Zealand and in a workplace context. And that likelihood is certainly reducing. But at the moment, the public health advice is that it is not zero. And indeed, it's probably going to be a number of weeks before we're actually able to say with any real degree of confidence that the risk of community transmission has been eliminated, if in fact that is ever the case. And of course, once we go back to opening up borders and changing the settings around potentially allowing infection into the country from elsewhere, then that risk assessment is going to have to be revised again. So certainly I think it is there on the risk register. We are comfortable dealing with other low probability, high consequence events, and I would suggest it's in that kind of category. So, workplace carcinogens, potentially, 95% of people who are exposed to them don't go on to develop fatal disease, but a small percentage do. And therefore we set workplace exposure standards and apply the hierarchy of control to them. Gross disproportion. I mean, to be honest, I think the economic impacts of the lockdown and the government controls are probably far more significant in the current situation than the cost of providing additional PPE and having to wipe down handles more frequently. So to my mind, we're not yet there at the level of gross disproportion around what is being proposed. But, as Tony has said, predominantly, I think the public health requirements overrule the workplace health and safety requirements, and therefore if they are mandated by a different legislative framework, we can't pick and choose and say this is grossly disproportionate under health and safety, ignoring the fact that it's actually mandated under public health.
Yeah, I'd agree with that too. You know, the test of grossly disproportionate is such a difficult threshold. I think it would be a tough hurdle to be arguing that if you ended up dealing with a sentencing in a health and safety context. And I guess I'm thinking too that at the moment we're in a bit of maybe a sweet spot with the risk. It might not be as low as this as we move forward into the next few months as things loosen up and travel increases. And so you'd want to be mindful of the fact that the risk is likely to increase. And so it's something that people are going to have to really keep a watching brief on. Just as we all have been every day, it seems to have changed in terms of our planning around the operations of our businesses generally. And I don't think that's going to change in a hurry.
I think it's important to look at controls with the health and safety work out what's reasonable, looking at risk. But actually, as far as I can tell from the legislation, which has not yet been finalised, the legislation will say, for example, 100 people. It won't say 100 people so far as is reasonably practicable. So the legislation that is coming in around this is not health and safety so far as reasonably practical legislation. It is setting standards. And if you're worried about the prosecution of it or being prosecuted for failure to comply, look at exactly what the standards are, and then you will know whether or not you're likely to comply. Don't try to put wouldn't have been reasonably practicable lens on it. I don't think that is what the level 2 legislation is actually going to be about. But I have to say, I'm hoping, and we are envisaging, that the use of the legislation will be very little used amongst the majority of commercial activities. It's only the extreme ones where people mix, where it is very difficult to actually control all of their behaviours, where I think the majority of enforcement will be, or where people deliberately decide that 10 is not an acceptable number and they will invite a whole load of people to their gathering, things like that. I expect those will be the areas we have most difficulty with.
Thank you. I think we need to probably bring it to an end now. I look back and I think, well, how long ago was it that the first case of COVID was reported in New Zealand? And it was only just over 6 weeks ago, so not a long time, but certainly our lives have changed forever since then. From my perspective, it's been quite incredible actually to see the community spirit, but also how business have innovated and collaborated and coordinated their approach to managing COVID-19 risks in terms of sharing resources, which has made for a much more efficient and effective response, I think, to managing the risks. So I think today it is the last day of Alert Level 3. It's a time for us all to reflect and hopefully not lose all of the lessons that we've learnt out of the lockdown, but also to prepare for what is going to be a new normal. The key messages I take out of today is to have a plan for how you're going to manage the COVID-19 health and safety rules and requirements. Share that plan with your workers and others who need to know about it, and also review it to make sure that it is working and effective. If you've got any questions or you need support with managing your health and safety obligations or returning to work or interpreting WorkSafe's guidance, then you can contact me or Brian or Mike Cosman. Will be happy, obviously, to help you with that. Failing that, I've also included a slide, which I'll just get back to sharing my screen, which is to the Health and Safety Association of New Zealand's register. So if you're looking for technical support there or professionals and a number of health and safety specialists, you can go to that register and find professionals there to assist you. So once again, thank you all for attending today. It's been fantastic, the number of people who've been interested. I think we've had just under 500 people online today. So thank you all, and good luck, and I hope you go well.